and this is going to be a pretty basic throwdown. The electric heart is what I want to talk about. Electric heart. Electric. If you look at a graph at what happens, there is a little bump right at first, and then we kind of go a little ways. There's a downward deflection, upward deflection, a big dip, and then it kind of comes back up, and then there's another bump like that. And I know that this is not beautiful, but it's what I can do right now. And this would be called an ECG, an electrocardiogram. Back in the day, because the Germans kind of originated this, it was EKG, cardio in German is with a K. Anyhow, this is called the PQRST complex. And so I want to talk to you about this electrical signature, and then I want to draw a heart and show you what's happening in the heart when this is going on. If we look at a heart, the heart points downward and to the left, and I will we'll call this the right atrium right here. This is the left atrium, right ventricle, and left ventricle. So we're looking as if a person is facing us like this. Heart points down to the left, the base is at the top right. Now, when the pacemaker gives rise to an electrical signature, it diffuses throughout the atrial syncytium, kind of like this, so that the whole entire top of the heart, listen to me, contracts all at once. That's the P wave. That's the electrical signature for the depolarization of the top part of the heart. And then when this gets depolarized, the nerves have a little pause right here. There's a place, there's something called the atrial ventricular node. This is the pacemaker. By the way, the pacemaker sets the heartbeat at about 80 beats per minute, roughly. But at the AV node, there is a little bit of a pause, and that's important, because what you want is you want the whole top of the heart to empty and fill the ventricles before the ventricles start pumping. Because if they start pumping and the valves are not closed, then the blood's going to go back into the atria. That's not cool. And that's actually what you have like in a mitral valve prolapse or something like that with some people. Once the electrical conduction moves down in the interventricular septum, it splits and it goes into the ventricles, so that the ventricles will then depolarize from the bottom up. And so the QRS complex is the depolarization of the bottom part of the heart so that it can push the blood upward. The reason that's important is because one of the exits out of the ventricle is to the pulmonary trunk, and the other exit is to the systemic trunk. And I'm going to talk about that in another video in just a minute. But we've got to push to the top. So we go from top down and bottom up like that. Now listen close, because I'm almost done with this. The P wave is the depolarization of the atria. The QRS complex is the depolarization of the ventricles. And then this T wave is the repolarization, or the recovery of the ventricles. So you might say, okay, see, I see a P wave depolarization. I see a, which is atria. I see atria depolarization. I see ventricle depolarization. I see ventricular recovery. Well, where is the atrial recovery? Right? Depolarization, depolarization, recovery. The atrial recovery is hidden within the QRS complex, and that's why you can't see it. And that is a basic outline of what happens in the heart electrically. It sets its own contractile rhythm.